I loved the program. It was fantastic. It taught me a lot. I got to interact with colleagues from across the U.S. in different disciplines, and I learned a lot about other disciplinary approaches to some of the questions I'd been asking.
Oh, it was phenomenal. It's the gift that keeps on giving, to be quite honest.
It was spectacular.
Transformative.
Game-changing.
It was the most phenomenal experience that honestly just shaped my career.
Oh, I love the HSS program. And I think for me, because I didn't come right after I did my PhD, it was actually a moment in my career where I was trying to retool.
It was an incredible experience to join forces with like-minded folks from all over the country who really care about population health.
It was an amazing opportunity to work with really talented people and people with many different perspectives, and it's going to shape my research and my friendships for the rest of my life.
For my own trajectory, I think the program was revolutionary. I was trained as a social demographer, and the fact that I got to rub shoulders with social epidemiologists, economists who are really interested in causal inference got me thinking in all sorts of new ways, and I am entirely a different researcher because of it.
The importance of connecting with scholars who are open to transdisciplinary collaborations has been a game-changing experience for me and my scholarship.
I describe it to my peers as the Cinderella program because they really just sweep you off your feet and give you every opportunity to succeed and put you in a group with the most interesting, novel, pushing the envelope kind of thinkers. They're really integrating across levels of analysis, and I just found it to be really intellectually stimulating.
Health and Society Scholars is a research fellowship program funded by the Robert Wood Johnson Foundation that was designed to bring researchers together to work in an interdisciplinary fashion to advance the science of population health.
When I was at Robert Wood Johnson, and even prior to that, I understood that the determinants of health went way beyond getting good health care, that they had to do a lot with the social situation in which you were living, in which you were born, your educational status, your housing status, and that if we were to make the kinds of improvements in health that we needed to make as a nation, we need to understand more how that happened. And so that led to the creation of the Scholars Program to develop the intellectual firepower to help ultimately us understand pathways to better health.
If we look at the determinants of health, there are basically 5 arenas, domains, in which health is determined. Our genetic predispositions, the social circumstances into which we're born, the behavioral choices that we make, the physical environments in which we live, and the care that we receive. The dynamics within each of those domains is vitally important in shaping health prospects of individuals and of society, but even more important than what happens within those domains is what happens between them at their intersection. Life occurs at the busy intersections in which we exist, in which we live and walk and move. And what's fundamentally important for society to progress is to have people who understand the dynamics of those intersections. So our aim was to develop a generation of intellectual and program leaders who could help us not only understand what the dynamics were at those intersections, but could move us actively into a healthier society.
We needed to better understand how to integrate all of the different factors that influence how healthy people can be. The economic factors, the genetic, the biologic factors, and the social factors, along with what we typically think of as our healthcare system. And we realized that we needed to do that because we were spending now $3 trillion on healthcare, and yet we are far from the healthiest country in the world. We have great inequity in our healthcare system and in the health status. And solving these very complex problems really required a different kind of researcher than we saw commonly in our environment.
It's taking a group of young scholars who are quite expert in their own disciplines, who realize that they need a little bit more, both methodological expertise as well as ability to bring other disciplines in order to investigate the issues they think are important. They're committed to health, and they're committed to understanding the determinants of health, and in many instances how their evidence can change the environments in which people live or health policies that will help make the community more healthy.
The program established 6 interdisciplinary sites across the nation at Columbia, Harvard, the Universities of Michigan, Pennsylvania, Wisconsin, and the University of California at San Francisco in collaboration with Berkeley. The program faculty included preeminent leaders in population health science.
The idea was that our 6 sites would collaboratively design the Health and Society Scholars Program together with what we call the Technical Advisory Committee at that time and RWJF staff to hammer out what would be the design and how we would have some coherence across the sites, but it also allow for some uniqueness around the sites.
The program was different from others in that it combined a cross-disciplinary activity, a group of settings that would work not only individually but as a team in promoting a program as a whole, and that would bring together scholars who came from many different disciplines and would together learn about one another's work as well as fresh approaches to health concerns.
Being a site director has been really fulfilling. Not only to mentor probably the smartest and most creative, most innovative young scholars, but to push our work further as well and to have a set of colleagues with whom we collaborate on an ongoing way.
The purpose of it was just so exciting, to finally have a program that thinks about the upstream determinants and actually the whole range of determinants of health.
It encourages the scholars and the faculty connected to the scholars to really think outside the box, think about how things that people don't usually think of as related to health might actually have important health implications. In addition to having its sort of scientific emphasis, it's also very interested in translation of evidence into actions, into policies or interventions, and so that's also a very unique aspect of the program.
This is a group of people who broadly come from social and behavioral science backgrounds, although not exclusively by any means, who have a view of doing scientific research that they know will advance the health of the population and being willing to step forward and sort of moving from the research they do to trying to put it into action and make a difference.
When seeing the research that the recent scholars are doing, I just see the boundaries continue to be pushed further and further.
I always come away from the annual meeting filled with hope. What can be more hopeful than exciting, brilliant young minds working on cutting-edge issues? And as we build this field, we fully expect that these are going to be the future leaders that help us build population health science.
My research is about several things. So I do environmental epidemiology using electronic health records. That takes into account where people live and the types of environmental exposures that they're getting. And so some things I've worked on include whether people living near large animal feeding operations are at risk for antibiotic-resistant infections. And then more recently, I've been looking at people living near fracking in Pennsylvania and birth outcomes.
My research was looking at the mortality toll of the U.S. obesity epidemic.
My research is on place and how place matters for health. I focus primarily on cardiovascular disease as many of its risk factors. So for example, we focus on Life Simple 7, which is focusing on things like diet and physical activity and smoking. Those kinds of things are highly structured by opportunities and access and resources. So I look at the ways in which place shapes health behaviors and other health factors that cause heart disease.
So I'm very interested in the determinants of health at older age. So I integrate demographic and epidemiologic perspectives to understand the life course determinants of being healthy and unhealthy in old age.
I do research on how the social environment affects health, mostly looking at socioeconomic status, education, and income, and how it relates to health outcomes.
I study how neighborhoods have changed since the height of the civil rights movement, so how racial segregation and class segregation have changed, and the consequences of that on health and health outcomes for blacks and whites in the United States.
I study mortality selection, which is the problem that our measurements of inequality are understated because we only measure the people who live long enough to be counted.
My research, broadly speaking, focuses on racial and ethnic differences in physical and mental health, with a particular focus on comorbidity, especially the co-occurrence of physical and psychiatric health problems.
My research early on as a graduate student wasn't focused on the kind of traditional areas of what psychology would consider its turf, in a sense. What I was really interested in was taking many of the things that we've learned through psychological science about how people make decisions, both cognitively, how they think about them, as well as from the behavioral point of view. What are the things that people need to do to have a different experience in making choices about their care? And I was interested in taking that which we had learned from psychology, from behavioral science, and applying that to a problem in healthcare and advancing how we deliver care.
My research focused on bureaucratic collaboration, trying to understand when agencies would work together to share problems that cross boundaries.
The Center for Medicare and Medicaid Innovation was created by the Affordable Care Act to test innovative payment and service delivery models for Medicare and Medicaid beneficiaries. So what that means is that, particularly for our group, which is focused on prevention and population health, we are testing ways that through the healthcare insurance and delivery system, we can improve population health.
So my research applies the growing field of network science to try to understand gun violence in U.S. cities. So what I try to do is use models that you would use in standard epidemiological research to treat gun violence like a contagious disease, not sort of metaphorically, but literally, how it gets transmitted from person to person, how it spreads within small networks, and then ultimately to see how we can leverage that information for violence prevention.
My research during the time and still is really on the intersection of communication, politics, and policy. I think a major conclusion I've reached in my research is that public health is inherently political.
We're proud of the scholars, immensely proud of what all these cohorts have accomplished. We expect great things from them, and we will draw on them in many ways as we go forward.
We wouldn't have the audacity to think about building a culture of health if it weren't for the kind of work that we've had the privilege of doing with you, the Health and Society Scholars Program. So thank you.
Coming in as an ecologist with my previous notions of public health, I've been able to be exposed to a much more comprehensive view of what population health could be. So I feel really lucky to have been part of this community.
It really has been an incredible experience and hopefully prepared me to take what I've learned in graduate school as a policy advocate beforehand and go out and do research that will really benefit communities and benefit population health. And I'm very grateful for the support and the experience.
Although it's somewhat bittersweet that the program will come to a close, it's also spawned a new society. It'll have almost 200 alumni strong, and I have no doubt that they will continue to carry the torch.
Well, I feel very good about the HSS program because it's trained a cadre of scholars who will generate knowledge to understand how population issues affect our health and hopefully make us get a health record that we'll be proud of.
I hope that there will be a lot more opportunities for people trained this way to work in many different areas, in academia or in the private sector, in government, nonprofits, because we need people who think this way to really make a difference in health.
One person said, in talking about what the program has meant to her, that she has found her tribe, she has found her community. And so that's what I would say too, that this is my community as well. What the program has done for me, it has validated me, if you will, in terms of, well, yeah, so I'm not so different after all. There are other people out there who want to do this kind of work in the way that I want to do it. And so it's been wonderful in that way, yes.
Cinderella is not just a funny term I use for it. I truly do feel that they believe in you and say you are something special, and we are going to make sure you can do the research you want to do.
I think you could say that Robert Wood Johnson Foundation was really more than a funder of the program. It was part of what made it work. It was part of what nurtured it, part of what made it what it was.
The Robert Wood Johnson Foundation is incredibly grateful to the many people who made this program a success. From the site directors to the scholars themselves and the faculty, to the National Advisory Committee, to distinguished guests who have come to speak at the meetings, and of course to our National Program Office, co-directors and staff. This program would never have been the brilliant success that it is if not for them.
The success of the program is not simply in the years it was actively operating, but in the work and the ongoing contributions that those who experience the program will be able to offer into the future. Of course that applies to the fellows, but I believe it also applies to the faculty who had the experience of participating in this program. And it certainly applies to those of us who were privileged to serve on the advisory board. We were, in our own ways, changed and enlarged by the experience of this program. And I believe it was a very worthwhile investment over time. I think it will pay continued dividends over time.
HSS gives me hope because we have now trained a number of cohorts of people who totally understand the ways in which health is produced, the ways in which social and economic conditions produce health over a lifetime. And none of those people are giving up. They're energized, they're out there, they're well trained, and they will continue to do the work, I think, long after the program ends.